Hello, my name is Brett Wise, and I'm a researcher in the Technology-Enabled Clinical Improvement Center, presenting the work Leveraging Haptic Sensor Technology for Force Mapping in Orthoses for Adolescent Idiopathic Scoliosis. This is collaborative work between Dr. John Voorhees, his clinical research team, and Dr. Carla Pugh, the director of the Technology-Enabled Clinical Improvement Center. Funding was provided through the Scoliosis Research Society. The gold standard of non-operative management of AIS is the prevention of progression through a custom-fitted rigid brace. However, the effectiveness of the brace is limited by the predominantly qualitative methodologies of brace fitting and adjustment. There has been some important prior work, notably by the group at Oxford, where they quantified the forces applied by Boston braces wrapping a pressure-sensitive mat inside. But this was only for a single-time measurement and was not longitudinal continuous readings. With this in mind, the goal of the project was to develop a novel technology that uses flexible force sensors to longitudinally and continuously measure the force profile of a scoliosis brace, resulting in better outcomes and fewer operations. The techie engineering team introduced 3 force technologies: a commercial sensor from the company BodyTrack and 2 in-house designs, a fabric matrix sensor and an individual fabric stencil. The team conducted pilot testing of each sensor and learned that the BodyTrack sensor was able to provide hotspot information, but was unable to capture high enough force values. The fabric matrix design had multiple engineering issues and was uncomfortable for patients. The custom fabric stencil design performed the best and captured the data necessary for this project. The team decided to follow the individual stencil design, which consisted of 2 piezo-resistive fabrics sandwiched between a piece of conductive fabric. This allowed for a lower profile and the stencils to be easily placed inside of a brace. The next step of the project was to test the stencils in the clinic. The results seen were promising in a case example of a patient that was tested with the new stencil designs. He was a 13-year-old male with a 25-degree right lumbar curve. He identified hotspots in the brace and applied our new custom stencils to those positions. They can be seen in orange, green, and red marks within the results images. The brace was put back on the patient and force readings were collected in different patient positions. Differences in voltage can be seen across the 3 individual stencils, giving the team confidence in longitudinal force readings. In conclusion, combining orthotics with force stencils, there is a huge potential to improve the efficacy of bracing through quantitative force mapping and providing aid in clinical decision-making related to brace adjustments with personalized data. Over the long run, this solution can improve orthotic treatments of AIS, resulting in the prevention of invasive, costly, and potentially morbid surgical interventions. There is also a possibility to generalize findings from this study across other pediatric and adult orthopedic therapies. Thank you for your time.